Face split massage is a technique that provides lots of opportunities for professionals. Result from the first procedure. The technique was created in 2013. The author of the technique is Larisa Vitvinova. The technique has a patent for invention of methods of facial rejuvenation. Thousands of women have become clients of face split massage and have preserved their youth and beauty. The Distance Learning Institute, under the guidance of Larisa Vitvinova, was created to train specialists where the masters and beginners all over the world are trained. Face split massage is a highly specialized technique for working on the face with tissue dysfunctions on the face and neck. Swellings, adhesions, fibrosis, wrinkles, bags under the eyes, and much more are eliminated with split massage. Face split massage is performed dry and always starts with a personalized diagnosis of age-related changes by palpation and visual examination. Look at these results and note the number of massage sessions. Face split massage is about results in a short time, almost from the first procedure. You can experience the value of face split massage right now. We will help you to make a short express diagnostics of the condition of your face and give you some recommendations. We will also show you how this diagnosis can be made on the client, because face split massage starts with an individual diagnosis. Training begins on the specialist's own face so that they can first learn all the techniques and feel all the tissues on themselves and then move on to the work with the models. What causes the second chin? Swollen, fatty tissue forms in the area below the oval, which must be relieved in a timely manner. Palpate the tissue under the oval and make sure it is clear. There are no painful sensations. If they still are present, then they need to be worked on. Gently massage the tissue as shown in the video.
Now we will check the tissues of the double chin area. We will start in the central part in the area where we have the submental lymph node, and typically it is noted the formation of edematous and fibrotic tissue there. And we need to palpate these tissues in order to figure out which state they are currently in. Let's turn to our model. In order to do this, we will have to grab with both of our fingers and hands the tissues under the chin. As we grab them, we want to lift them up and try to feel with our fingertips what's inside. You might feel small nodules or some tissue thickening. As we move down from the chin going down the neck, we might feel that at the bend of the neck is the most sensitive area. Might feel more fibrotic tissue here. We have already palpated our tissues under the chin. And we will palpate from the center of the chin towards the jaw edge. On one side and then on the other. Somewhere in the area of the submental lymph node, we typically can observe changes in the tissue. Why does that happen? Right next to there is a sternocleidomastoid muscle that typically is within increased tension, especially for right-handed people on the right and left-handed on the left. And because of increased tension, the tissue loses its nutrients and we have fibrotic tissue growing in that area. Additionally, right above that is the end of the masseter muscle. Its edge is located right there, and this muscle is also in increased tension and can worsen the blood circulation in that area. So now we will actually test going from the center towards the end of the jaw, which part of the tissue is more sensitive. Where we have the fibrotic tissue, and we will do that on both sides, the left and the right, and see which one is stronger. Let's start the palpation. we will move from the center of the chin, right under the area, and towards the ear. You want to make sure that you palpate very thoroughly. Try to lift the tissue from the bone and feel it between your fingers. And make sure you note which part of the tissue has changed, is there fibrotic tissue changes, and how difficult it is to move the tissue forward. And it looks like we can't as easily move to the end of the jaw towards the location of the sternocleidomastoid muscle attachment.
And then make a few lymphodrainage movements. After completing the technique, it is necessary to perform lymphatic drainage movements along the neck. To do this, use the palm of your hand to stroke the opposite side of the neck from the chin down to the supraclavicular lymph nodes on one side and then the other. This technique can also be performed on a client. Now we will move towards the oval zone. For this, we require a change of position. The under-oval area. Our task is to palpate it. We know that in the zone under the oval we have the main lymph nodes. Now I am in the area of the collated lymphatic knot. With my fingers I'm feeling the tissue. I can see that tissue is dense in this area. It feels very patchy and heterogeneous. Model most certainly feels some painful sensations. I understand that this volume must be massaged, withdrawn, so that the model doesn't develop more of a double chin, but we must always begin with the trapezius muscle. Whether or not you may have nasolabial folds in the near future, or they have already formed, is influenced by the condition of the zygomatic muscles. As shown on the video, palpate these muscles, assess their condition, whether there are no spasms and painful sensations in them.
Now we will move on to the zygomaticus major muscle. If we look in the mirror, we want to check out which side the muscle is shorter. In order to see this, we will smile and we will see on which side the smile is shorter. From the upper to the corner of the mouth, which length is shorter. Then we will move on to palpating deeply the zygomaticus major muscle in the area where it crosses the tear through. As a rule, if on the face you can find the formation of bags under the eyes or soufs, that means that where the under-eye ligaments cross with the zygomaticus major muscle, there is some sort of formation that will hold tension. Additionally, when we palpate the zygomaticus major muscle, we can find some tension between the crossroads of that muscle and the levator labiae superioris. This will show a direct relationship in the formation of the overhanging fold. In order to diagnose the zygomaticus major muscle, we need to smile and find the length of the smile from the attachments of the muscle on one and the other side. You will find that on one of the sides the length will be shorter. In Julia's case, it's on the right side. That means that on the right side the zygomaticus major is more tensed. And we will start to palpate on the side of the muscle that is more tensed. In order to know that you're located exactly in the muscle, we need to check ourselves, and in order to do that, we can smile and we will be able to feel if we have the muscle between our fingers or not. And once we go along the whole muscle, we need to pay close attention at the crossroads of the muscle, levator labiae superioris and the zygomaticus major and the zygomatic ligament. Because as a rule, typically at these crossroads, we will have tension and formations.
And also palpate the condition of the fatty tissue in this area. Is it already swollen?
We know that the subcutaneous fat pads are located deep as well as subcutaneously. And we now will want to look at the condition of these fat pads over the muscles that we just tested to see if there is any edema or sensitivity in the tissues. First, we want to palpate superficially our tissues In order to do that, we just need to grab superficial tissue between our fingers and palpate it. That doesn't mean you have to go deep. We just want to stay in the subcutaneous adipose tissue, because it's important to remember that conditions can be in the subcutaneous as well as in the deep layers. We will palpate the mid-face area, the sides of the face, and then you want to make sure you go into the deeper layers. And to compare, is the sensitivity bigger in the subcutaneous or the deeper tissues?
In the same way, it can be done on the client.
Let's ask our model to smile, maybe just a little more. Now we may observe that from the left side, the distance between higher and lower attachment of the zygomaticus major muscles is less than from the right side. Based on this, we may conclude that the zygomaticus major muscle from the left side is under a more prominent strain. Now let's ask our model not to smile. Based on our observations, it was noted that if from the one side the zygomaticus major muscle is more toned and pulls the corner of the mouth upwards, then on the opposite side, more toned will be the muscle that will pull down the corner of the mouth. From one side, the corner pulls up, and from the other, it pulls down. We have now determined that from the left side, please slightly relax your jaw, our model has a more toned zygomaticus major muscle. Now I am lifting the zygomaticus major muscle and am feeling it with my fingers. Under my fingertips, I feel that, namely under the situation when crossing with the muscle lifting the corner of the mouth and tissue, in the muscle itself there is a clamp. We are now moving up. When crossing the zygomatic ligament, I can't feel any denseness in the tissue. I can feel the denseness I feel precisely when crossing the muscle that's lifting the corner of the mouth. Now I am palpating the zygomaticus major muscle from the right side. Here I also feel the increase in the tone of the muscles, exactly in this spot, when I'm going over the area of crossing of the muscle lifting the corner of the mouth. When I move upwards, moving towards the zygomatic ligament, I then cannot feel the large grip of tissue, maybe just a little over here. It is likely that from both sides the large zygomatic ligaments may have the clamping when crossing the muscle lifting the corner of the mouth, which is located right in this region.
If you have bags under your eyes, or if they may appear soon, the condition of the tissue under your eyes will tell you. Perform the diagnostic technique as shown in this video, and it will become clear what tissue changes have occurred and how soon they may appear on your face or on the faces of your clients.
Here it is. Here is the shape. Here is the area where the greatest tension is from the zygomaticus minor muscle. You can see the rippled, changed tissue here. Previously, the malar bag was higher. From this place, we covered this entire area completely. Could you squint your eye, please? No, not here. Squint your eyes once more? No, not quite. Squint as if you're looking at the sun. You see the movement. We constantly do this movement in this area due to the work of the orbicularis oculi muscle. And this surface malar bag, which filled all this space, relax your eyes, becomes thinner in this area. Further, it will be smaller and smaller in this place. Finally, it will move down here, as you can see on older faces, and will be one shriveled bag. Please note that on different eyes, this process took place in different ways. If you tilt your head, you can see that such an area has emptied here. Now look at the right eye. Here the area is still like this. Here its form is still more open, and here it is more shriveled. It is at the surface level. In the previous video we discussed how to diagnose the condition of malar bags. If you move the preorbital region, then you will see that this is an area of thinning. Julia, please squint your eyes. You see the movement that we make all the time in this area. This is where the area of greatest tension is. As a result of this movement, a fibrous strip was formed here. The malar bag has narrowed down to its size. Further, the infraorbital area and the more and more devastated area under the eyes will be more and more exposed. You have already palpated and felt where the dense areas are on the bone. The malar bag is still more distributed here, but in this place is the base, which becomes denser and becomes more noticeable. I am working at the Prague seminar. We filmed the upper part of the face, work with the eyes. One of the most difficult areas is the area of the levator labii superioris muscle attachment, where the zygomatic and infraorbital ligaments begin and where the suture between the upper jaw and the zygomatic bone is located. You already know that when the client is lying down, you can't see anything. There is an absolutely smooth tissue, an absolutely smooth area under the eyes. I have already worked a little and it's in a good condition. Usually if you make such a provocation, you can observe a fairly large amount of minus tissue in this area.
These few examples show how face split massage works. First, an individual facial diagnosis is made. Tissue dysfunctions are identified and then corrected using face split massage technique. You can learn more about the technique by purchasing a trial lesson along with a consultation from our instructor, a cosmetologist. Take another look at these results. Real and not artificial. Youth can be preserved with a face split massage. Do not delay your training. Every minute, our face and the faces of our clients are aging. Adhesions and fibroses are forming in the tissues, which after a while we will see as wrinkles, sagging and bags under the eyes. This can be stopped with a face split massage. The sooner face split massage enters your personal and professional life, the longer you and your clients will keep your face young and beautiful. To sign up for training or a trial lesson, visit our official Instagram account at splitmassage_online or visit splitmassage.org.